decided to make a video to demonstrate what our technologists should and shouldn't be doing in the field as far as wearing personal protective equipment or PPEs and how to properly disinfect the equipment and themselves after exposing themselves to a patient. On a normal circumstance, of course, we all come in, we put our lead aprons on, we go in, we do the exam with our machine. Once you're done with that, come back out, and we all are using dispatch wipes. These are the wipes that we will use to wipe down not only our lead apron before you take it off, then you can take it off, then you also wipe down any parts of the machine and cassette along with the laptop that you've touched and the control panel. Once you've done that, dispose of that. You can take your apron off. Then you need to go find a place to wash your hands with soap and water. Of course, the CDC recommends washing your hands for 30 seconds using either hot, cold, or warm water. Doesn't matter the temperature. If water is not available, of course, technologists should use hand sanitizer. The next scenario I want to talk about is if we are exposed to doing a patient in isolation. First thing you'll do is don your lead apron. The next thing and the most important thing is your mask. I'm trying to keep my apron up here. Apologize about that. The mask will actually be the first and last thing to go on and off. Again, this is only for isolation patients that we are told about. You have a hair piece, especially for the ladies or anybody with longer hair. Your gown, and lastly, your gloves. So at this point, we're ready to go in and do an x-ray exam on a patient that's in isolation. Once we've completed that exam, the very first thing you're going to do is keep everything you have on. Again, you're going to get the dispatch wipes. You're going to take a wipe out, or a couple, depending on what you need. Again, wipe down the control panels, wipe down the cassette, wipe down the laptop, and the covers here along with the rails. Any part of the machine that you have touched, needs to be wiped down. Dispose of that. The very next thing that's going to come off, of course, and remember I said the mask is the first and last, is you're going to take the gown off. There's a certain way. You grab the inside of it, never touching the outside. Dispose of that. No need to wipe down the apron at this point because it was covered by the gown. So you can let the apron off. Lay that down. You can now dispose of the hair piece. Before you take this mask off, again, you should go find soap and water, wash your hands. If there's no soap or water available, again, use a hand sanitizer. Only then and after then that you've either washed your hands or used hand sanitizer, you can now remove your mask. If anybody has any questions about this, please feel free to contact us at 1-866-483-9729. Thank you.